Hello, Dr. James Bogash, expert in health and longevity, and the interesting study looking at how to save lives in the ICU, specifically with hospital-acquired pneumonia. So nosocomial, whatever you want to call it, but when you're already sick and then you develop something like a bacterial pneumonia while you're already sick, and especially on a ventilator, like that's a recipe for disaster. It's something we want to avoid. For a while there, they were using chlorhexidine mouthwashes to try to lower the risk, thinking if we could reduce the bacterial load in the mouth, we would maybe reduce the exposure into the lungs. Well, turns out that actually increased the risk of hospital-acquired pneumonia. And before you think that sounds strange, probably has everything to do with this blatant wiping out of the oral flora. We've certainly had lots of conversations about the gut flora and how stupid it is to randomly wipe it out with antibiotics or wantonly wipe it out. And it's no different with the oral cavity. We kill off the protective flora as well as the damaging flora, and it opens the door for infection because we've lost our warriors, our guardians at the gate, if you will. So in this particular study, it was a meta-analysis looking at over 15 different randomized clinical trials by 2,786 patients, and they looked at toothbrushing. Simple, approach, either done by nursing staff or done by a dentist or dental professional. And they found that it lowered the risk of hospital-acquired pneumonia by 33% and ICU mortality by 19%. Holy crap! Like, that's a pretty for something that's really now. Of course, a toothbrush and toothpaste in the hospital probably runs you $3,000, but in reality, 25 cents worth of product probably saved lives in this particular scenario. This protection was largely with ventilator-associated pneumonia, but the authors thought that if they had enough sample size, they'd probably see the reduction of hospital-acquired pneumonia in non-ventilated patients as well. So what does this mean in general? Because we don't want to get to the hospital in the first place, but it really boils back down to how important our oral health is. And we've learned the past 4 years that the microbiome and our oral microbiome and our respiratory microbiome communicate. And if we have a healthier oral microbiome, we can have a healthier respiratory microbiome and fight off infections that we don't want that can lead to mortality. So how do we improve oral health? Diet, a good quality diet, will naturally feed the flora of your oral cavity, just like it will the gastrointestinal and the urinary tract and your skin and everything. I'm a pretty big fan of the electric toothpaste, like a sonic toothbrush. We want to make sure that we're cleaning the gums and the teeth as much as we can. Goes without saying that smoking is really bad for the gums and the teeth. But then the other thing, I'm a pretty big fan of tongue scraping. Not the little rake-like ones. The one I use is, I'll put a link in the description, but I use the BreathRx has one that looks like one of those saws, and you can bend it, and what comes off your tongue even after you've brushed your teeth is abhorrent. So a couple times a week I'll get back there and scrape out my tongue just to make sure that I'm trying to make sure that I don't have any residual gunk for bad bacteria to grow on. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.